Hey everybody, we are going to talk about specialized exams. So it's loading up, the PowerPoint's loading. We're going to talk about specialized exams related to medical assisting. So I'm going to do this part where you guys can see the PowerPoint, and then I will also give some information and I'll record some during my class. I'll probably record more of my class once we get past general patient exams so that I have a day lapse where you guys are working on this and they're working on the other. So, yeah, as you can see, the objectives are listed that you can briefly describe the medical specialties of allergy, cardiology, dermatology, endocrinology, GI doctors, neurology, oncology, ophthalmology, orthopedics, otology or ear doctors, surgery and urology, and in all of those offices, medical assistants work. So you need to have kind of a basic overview of what they do and what they may need you to help them with. Describe types of exams and diagnostic tests performed in these specialty areas, and the medical assistant's role in these examinations and tests. Identify and describe the most common diseases and disorders seen in medical specialties and typical treatments for them. Describe your duties as a medical assistant to perform scratch tests, and that's in an allergist's office. Describe medical assistant's role in assessing in a sigmoidoscopy, that's with a colonoscopy in the office. Outline the medical assistant's responsibility in preparing ophthalmoscopes for use, and describe the medical assistant's role in assisting with needle biopsy. So these are all highly specialized exams that are frequently done in specialty offices that a medical assistant may help with. So, if you're employed in a with a specialized or a doctor that's in a specialty clinic, then you're going to have your general role, some of the things you would do in that general patient care role, but you're also going to have other specialized examinations that are done. You're going to have things that are specific to each specialty. Things that orthopedic surgeons do in their office, or orthopedic doctors do in their office, ear, nose, and throat doctors may not do in theirs. So know that that's one of the things you will learn if you go into a specialty. You'll become very proficient in what is required in that specialist office. Many physicians specialize in various fields. Some doctors will specialize in wound care and general medicine, or they may be an ear, nose, and throat doctor that also works with eyes as well, different eye procedures as well. You may have a GI doctor who also works as an allergist. So sometimes they specialize in more than one particular thing. You will be asked to help with diagnostic testing and certain procedures. So just be aware, and understand that if you're applying for a position in one of those specialty clinics, you will have things that you'll do there that you're asked to do that you wouldn't necessarily be in a general practice clinic. When they work in specialized areas, they focus on one particular type or body system, where other general practice doctors, they focus on the body as a whole. So you have to be prepared with that in that specialty clinic to be able to ask questions, even on the interview level, on what you know about what your tasks may be. The more you know, the better you can explain the role, and the more likely you are to be comfortable and also to be hired into that position. An allergist is someone who specializes in allergy diagnosing and testing for allergies. That's maybe pollen, it may be spores, molds, it may be ragweed, it could be milk or nut allergies, but they are going to do testing to see what people are allergic to and then determine treatment to go along with it. And like I said, substances that cause an allergic reaction are called allergens. So no, allergens cause allergic reaction. The reaction may be local, or it may manifest themselves throughout the body. So you may just have a place that you come in contact with something where it's itchy and red, or it can be that minor or as severe as an anaphylactic reaction. So we talked about that, and anaphylactic reactions are life-threatening. If you remember from respiratory, or if you remember from first aid, You actually can go from a person having an anaphylactic reaction can die within 30 seconds to 30 minutes. So allergists are very important. Part of that allergy examination involves that complete medical history, along with some other basic blood work, drawing some basic blood work. Most of the time, sometimes it's done at the primary care doctor's office, and then it's sent over. Other times, it may be something you have to do there. You need to understand the function of the immune system. So that's that when we read that unit over the body systems, you have to understand how the immune system works to understand how allergies are treated, how the inflammatory process works, and how the immune system works. Also know that whenever allergies are tested and treated, sometimes they're treated with just avoidance. Don't eat things that have peanuts in them. Don't eat things that have milk in them, dairy in them, gluten in them. And then sometimes there's medication. They can do allergy injections to help desensitize from either a small amount of that substance, and then it progresses over time. So they may get 0.05 milliliters of a medication that the allergist combines for them that may be 1/1,000,000%, but they graduate doses up until they get to a certain point where they can tolerate it. So there are different types of allergy testing, and depending on the patient and depending on your physician that you work for, you may do a scratch test. Be sure you know what these are. You may do a scratch test, and that's where the patient is given specific allergies, and you're seeing that on the right, where their skin is kind of scratched with that medication to see if they're allergic to it. It'll have more of a localized redness to that area. Intradermal testing is that's actually giving that medication in small doses, very diluted small doses under the skin. Patch test is placing linens or a paper patch on the skin, and then they put a small amount of the medication onto that paper or that piece of linen that's on the skin. It's left on there for a specific amount of time to see how your skin reacts. And then there's the radioallergosorbent test, or the RAST test. The RAST test is used not so much locally in our area. We see the scratch, the patch, and the intradermal test done, in the surrounding areas by our radiologists, but RAST tests are done a lot in the Metroplex area. Cardiologists. Cardiologists are physicians who specialize in heart disease and disorders. So to work in a cardiologist office, you really need to be familiar with the cardiovascular system, with the heart and the vessels. And typical examinations that are used to measure in that office. They do EKGs regularly, electrocardiograms. They do those on every patient. Stress testing can be done in two ways. Remember that stress testing can be done in two ways. It can be mechanical, where you walk on a treadmill and you're given first they take an x-ray or some images of the heart at rest. Then they give you a chemical, and you sit and wait for about 30 minutes. It's a nuclear medication. And then you go walk on a treadmill till your heart gets to its target rate. Then where they bring your heart back down to a normal, and they take some more images. If they're unable to do that, they put the imaging machine over you, and while you're under the imaging machine, they give you medication that would make the heart simulate what it would be doing on the treadmill, and they do images the whole time. And then there's an echocardiogram. An echocardiogram is basically a sonogram of the chambers of the heart while it's pumping. They can see if there's valve issues, if someone were to have endocarditis or some other things going on. So stress test sees how much stress the heart can manage before it gets into kind of overload, and you may have shortness of breath or chest pain. An EKG tells us about the electroconduction of the heart. It also can tell us if someone has electrical issues or has had a past heart attack. Um, so electrocardiogram begins with blood pressure reading to evaluate all overall cardiac health, and then it's done. Then diagnostic tests are done and used related to different heart disorder. So what you're seeing on the right there is someone getting a stress test, a manual stress test, walking on a treadmill. They've already had it, and it runs an EKG or an electrocardiogram the whole time they're on it. Then while they're resting as well, and then once again they do those images afterwards. I've already discussed what these are. These for you are these are done for you. The one thing I haven't talked about is a Holter monitor, and that's 24-hour recording of the electrical conduction of the heart. It can be worn 24 hours, 48 hours for 2 days, or it can be worn for 2 weeks, or it can even be worn for up to a month. So there are Holter monitors that last different amounts of time. In the beginning, they were about the size of a beeper. They were probably 4 inches by about 3 inches and about an inch thick. Now they are about the size of, I'd say about the size of a $50. They're small and very portable. You just unsnap it when you get in the shower and snap it back on. Easy to manage. An angiogram is where an angiogram is an X-ray of the blood vessels. They inject IV contrast or an IV medium into the vessel, and then they go and they go into the groin or sometimes into the brachial artery, and then they follow that femoral artery brachial artery up to look for blockage. An echocardiogram, once again, is an ultrasound of the heart. Cardiac catheterization is where they actually can go in through those leg vessels and look at the chambers, heart all the way into the heart, and look at the motions of the heart with fluoroscopy. Fluoroscopy is basically they watch all of the things that they're doing on a screen above their head while they're doing the procedure. So those are the most common radiography techniques for cardiologists. Now, dermatology. Dermatologists are someone who treats skin disorder and diseases. So you have to understand the skin. We did a unit over skin just so that you understand some normal things that go along with the skin. You may have to assist with positioning and draping the patient related to skin exams, skin scrapings, skin biopsies, or wound cultures. Those are things that are commonly done by a medical assistant in the dermatologist's office. They will ask you in the beginning to do a whole body skin examination on certain patients, and that's looking at the entire top layer of skin. You look at from the toes, from the top of the head to the bottom of the feet. So you have to ask those people to take their clothes off. You have to make them feel comfortable, and you have to be comfortable and be very professional about it. You don't want to expose them. You want to be sure the door is closed. You want to give them an opportunity to drape and just show you one area at a time. You don't want them just to be standing completely naked in a room. But they can show you in a very modest fashion, whether they're covered up and they lay on one side, then they lay on the other, and you look at them from head to toe. Things that conditions or disorders commonly seen: skin cancer, warts, eczema, impetigo, psoriasis, scabies. That would be lice under the skin, body lice, moles, ringworm, contact dermatitis, which is inflammation of the skin while it's being touched. Acne vulgaris. That's normally what you guys think of as acne on the skin. Hang on one second. I'm gonna put you on pause I'm gonna pause for 1 second, and I'll be right back with you. Okay, guys, sorry about that. Let's get back to where we were. So be sure that you understand what each one of these are and what causes them. Moles are just red, raised, black, tan, or red spots on the skin. That's excessive growth. Ringworm is a fungus. Be sure warts are a virus. Be sure that you are familiar with what causes those. So if we look at these, which one of these is the most serious type of cancer that you see? Which one of those you think is the most serious? The far left, the far right, or the middle? So melanoma is always black. Squamous cell carcinoma lots of times will bleed. Basal cell will kind of crust up and look like a raised area. But melanoma lots of times is flat and it will have a really dark black center. It'll look sort of like a dark spot on the skin, and as you can tell, the edges are uneven. There's no real form to it. An endocrinologist. So an endocrinologist is someone who treats disorders and diseases of the endocrine system. That's hormonal issues. It can also be diabetic related, growth related, metabolism related, and reproductive related. They treat all of those things. So you assist in lots of different exams and you take lots of specimens, lots of blood work, and lots of different types of specimens for an endocrinologist. Endocrinologist, you have to have a very thorough medical exam, including family history, also their complete medication history. You're going to assess the patient's skin, their weight, their cardiac function. They all can be impaired. Their vital signs can be impaired due to different diseases of the endocrine system. You're going to do urine and blood tests often to measure hormone levels and blood sugar levels. They may do ultrasounds and other x-rays and iodine scans for most of the time those are sent out. There may be ultrasound done, but usually they have a tech that does that. Most of the time you're going to be collecting that diagnostic urine and blood test, also preparing them for taking that history. Some of the things they treat: diabetes that we talked about, elevated blood sugar or hyperglycemia or elevated blood sugars, thyroid disorders, which would be hypothyroid or low, hyperthyroid or high acting thyroid, and goiters, which would be an enlarged area of the thyroid gland. Cushing syndrome, and that is where the adrenal cortex produces too much corticosteroid and causes Cushing's disease or Cushing's syndrome. So those are remember those common diseases. Gastroenterologists, they are going to study everything in the GI tract. So that goes from the esophagus to the rectum and anything there in between. There's lots of different procedures that they do. They do lots of blood work. They do lots of different radiology and scans and scopes. You'll have to be able to teach the patient how to prepare for exams and answer their questions, and know if there's alternative things that can be done. Some of the common examinations are gastric lavage. That's where they obtain a sample of the stomach contents through an OG tube. Endoscopy, which is where they insert a visual scope into a canal of the body. Endoscopy can be done orally or rectally. A perioral scope is just going to look from the esophagus to the stomach, esophagus to the stomach and or to the duodenum, so it's going to go down the throat. A perioral will go down the throat, down the esophagus, to the stomach, and just outside that pyloric valve that goes into the duodenum. Or they can have a colonoscopy, which will be inserted in the rectum and view the entire large intestine. So just be aware that those are the types of scopes that are regularly done. A proctoscope examines the lower rectum and the anal area, and then the sigmoidoscopy is only the sigmoid part of the scope, the colon. So you have the ascending, the transverse, the descending, the sigmoid, and the sigmoid colon. So be sure that you're familiar with those types of scope and what type and where they can be, what they can view. Common lab tests: stomach contents test. They'll check for blood in vomit or blood that would come out in a lavage specimen. Urine and stool cultures to see if there's blood in the urine, blood in the stool, if there's ketones, if there's blood, what all's going, elevated protein levels in the urine. A cholecystogram may help them look at the gallbladder to see if there's any kind of issues with the gallbladder and gallbladder function. And then they use ultrasounds not only for diabetic, but for an enlarged pancreas, spleen, and liver, also to see if someone might have a fatty liver or tumors or other growths on the liver, spleen, or pancreas. They do barium swallows a lot. The patient will drink the barium, and then they will do a study, and they will watch as the barium goes down, and see if there's obstructions, if there is ulcerations, or if there's reflux with a barium swallow. With a barium enema, they can detect abnormalities like cancers or other types of obstructions, ileuses, things like that in the large intestines. Common disorders. We can't always tell by how uncomfortable someone is how severe their stomach disorder is. Sometimes patients have no pain and they have a very acute disorder. Sometimes patients have a lot of pain and it could potentially not be an acute disorder. So we have to be very careful and very meticulous on how we document signs and symptoms. We're going to look at some other disorders of the GI system a little later. Neurology. So a neurologist studies disorders of the central nervous system, the brain and the spinal column. They are going to, as a medical assistant, you're going to have to not only be able to have equipment ready and help the patient know what's going on, explain how they're going to need to be positioned, what you're going to need to do for them, but you're also going to have to assist a lot in those procedures, handing tools, supplies, instruments, testing materials. So you're going to be you're going to be hands-on with a neurologist often. Common examinations would be cognitive function or a mental status exam. And there's mini mental and an extensive mental exam, testing cranial nerves, motor nerves, reflexes, and the sensory system like the sight, sound, smell, and taste. You may be testing those to see about neurological damages. An electroencephalogram, sorry, can't talk today, or an EEG would be, or an ECG would be where you can record brain waves or brain activity. They also do angiograms at times to see if there's vessels somewhere that are being clogged, brain scans, CTs, and MRIs. Myelograms look at muscle. Head x-rays of the skull and of the spine, and then electromyogram, which will be a graph of how muscle movement happens related to thought process. So PET scans also can help us study blood flow and metabolic activity in the brain. We can see what's going on in the brain with a PET scan. We see a lot of issues in the neurologist's office related to trauma, head trauma, traumatic brain injuries, paralysis injuries related to spinal cord damage, encephalopathy, meningitis, peripheral neuropathies, and other common diseases like other common neurological diseases like brain tumors or different cerebral palsy, things like that would also be things that would be seen in a neurologist's office. So a patient has a seizure disorder and will be getting an EEG. He asks, what is an EEG? And what would you tell the patient? That you're going to put some electrodes on them. This is how you should answer it. You're going to put some electrodes on them, and it records the electrical activity of the brain. So they're going to put some electrodes on the scalp. Sometimes it comes in a cap form, sometimes not, and it's going to see it's going to check your brain activity. Okay, hang on a second, guys. All right, we're good. So oncologists are physicians who study tumors and cancerous growths. Tumors can be a lump of abnormal cells in a location that they would normally not be, but that does not necessarily mean that it is cancer. Sometimes tumors are benign or non-malignant, which means that they're not a cancer type cell. They're just a growth of cells that can be hopefully removed that aren't causing any issues. To work in an oncologist's office, you need to be aware of various types of cancer and be prepared to explain side effects of medications, side effects of treatments, and what treatments may happen. Also, to work in an oncologist's office, you have to have a good grip of psychology so you can help patients deal with potentially terminal illness. Metastasis is a transfer of abnormal cells from one body part to another. So the tumor may have originally started in a kidney, but it has metastasized to the brain. Know what metastasis is. Diagnostic testing, blood specimens, x-rays, CT, MRIs. CEA is a cancer antigen screening, which is a blood work, ultrasound, biopsy. Those are all common. Know which ones are common diagnostic testing. The types of treatment, surgery for removal, radiation, and chemotherapy may be done thereafter to kill off or stop the growth of any cells that may have been missed in surgery. Sometimes you have to use chemo and radiation to slow down the progression because at times tumors are not operable. When something is non-operable, sometimes they can shrink it with radiation or slow the cell growth. Same thing with chemo. It can target specific cells and it can kill off malignant tissue from further growth or may make them go away altogether. Ophthalmologists are doctors who study and treat eye and tissues near the eye. There will be you may perform procedures that involve measuring different aspects of visual acuity. So using an eye exam is to make sure someone's not colorblind, and their intraocular pressure. So visual acuity is what you think about most of the time, but also color vision and intraocular pressure are important. Intraocular pressure, especially for people with glaucoma. You have to test that to make sure it's staying stable. So what they do in an ophthalmic examination is they inspect the interior of the patient's eye, the retina, the optic nerve, the vessels, and the visual field to see about peripheral vision along with vertical vision. They test for glaucoma with a tonometer, and that also checks for intraocular pressure and refraction exam. Medical assistants sometimes do the tonometer and the refraction exam and document that before the eye doctor ever comes in. Some common diseases are styes, which is an infection of an eyelash follicle, conjunctivitis, which would be like pink eye, where the white part of the eye gets really red and painful. Blepharitis is chronic inflammation of the corners of the eyes or the eyelids. Ptosis is drooping of the upper eyelid. So those are common things you see. Cataracts, glaucoma, retinal detachment. Cataract is where an area of the lens of the eye gets real cloudy. Glaucoma is where the pressure in the eye builds and can cause visual damage from the center lots of times out. Retinal detachment is when the retina itself separates from its layer of the eye. Orthopedics. These are our bone and joint doctors. They are specialized in muscular and skeletal disorders. And in a orthopedics office, they do X-rays, casting, cold and hot treatments, and they also help with injections related to steroid therapy. You may prepare those for the physician and assist in those. Suture removal, staple removal, and other kinds of educate the patient on surgical procedures and other types of therapy. So what's going to be important is to assess the structure and function of the muscular system, taking that good patient history. You may have to drape the patient or position the patient so that you're giving support to the patient so there's less pain during an exam or a casting. Orthopedic diseases and disorders. A lot of docs don't deal with true back pain, but they will do with back pain due to hip disorders, muscle strains, arthritis, tumors, fractures, joint other joint disorders. They will deal with those, and those are things you need to be familiar with if you're going to work in that office. An otologist or an ear doctor. They do hearing screenings and other treatments related to the ear. They do earwax or cerumen. Cerumen impaction would be earwax impaction, and they remove that. Otitis externa and otitis media, so ear infections on the external part of the ear or in the middle ear. Pruritus, mastoiditis would be inflammation of the mastoid process. Meniere's disease, tinnitus, which is ringing in the ear, and presbycusis. Those are all common disorders that are treated in the ear doctor's office. Surgeons, they may do anything from simple surgical procedures into the office to doing major repair and organ removal in the surgery center or in the hospital. So you're going to have to be familiar in a surgeon's office with basic wound care, suture removal, surgical removal, explaining and assisting with procedures in his office, and also post-operative care. When someone calls and says, my incision's red, well, you have to know other questions to ask. Is it draining? Are you running a fever? What color is the drainage? What is all those kind of questions. So you've got to be aware and understand what things are supposed to look like after surgery. Neurologist diagnoses and treats issues related to the urinary system. So they're going to do a general exam. They're going to do normal patient history, and then they may have you collect urine and blood, maybe some other specimens. You also have to educate patients on different procedures. They may be doing Botox for neurogenic bladder. They may be going to do a vasectomy. They may be going to do a TURP. And so you have to educate these patients on what's going to happen before and after those procedures. They commonly examine blood and urine and semen specimens. They do cystometry and cystoscopes and testicular biopsies for testicular cancer. Cystoscope is where they go in through the urethra and look at the bladder itself. A cystometry tests the pressure or the how much reserve is left in the bladder. Cystitis is what you guys think of as a urinary tract infection. Epididymitis would be an inflammation of the epididymis, which is near the testicles. These are just kidney stones, prostatic BHP or prostatic hypertrophy, benign prostatic hypertrophy, prostate cancer, impotence. And hydrocele issues. Those are common things that they see in the urologist's office. So, what examination should be done by a 27-year-old male patient to detect cancer? We want him to do regular monthly testicular exams, self-exams, where they feel their testicles to see if they have some kind of lump or growth that should not be there. All right, guys. So be sure you familiarize yourself with anatomy and physiology. If this hasn't told you that you need to be familiar with the anatomy and physiology of all systems to work with specialty doctors. You need to understand diseases, disorders, and be able to educate patients related to their concern. You also have to be able to perform exams and assist the physician effectively. All right. Well, that's specialty disorders. We are going to stop here, and we will pick back up with our next lecture soon. Thanks, guys. Have a great day.